The Omicron COVID-19 variant is tearing through the United States. Data from Johns Hopkins University reveals the country recorded over 1 million infections on Monday, a new record for that country, making it the hardest hit by the pandemic. Our U.S. correspondent Simon Marks joins me now from Washington, D.C. for more. Simon, very good evening our side. Thank you so much for joining me. But we're talking about over 1 million, COVID-19 positive tests within the last 24 hours. How many of these are attributed to the Omicron variant?
Well, the answer to that is we don't know, because the Centers for Disease Control down in Atlanta a couple of weeks ago said that the Omicron variant was now the dominant variant in the United States, but then several days later revised that and said no, Delta was still a very prevalent variant in the US. And I think what we're seeing here, first of all, this is a global 24-hour record. No other country in a single 24-hour period has reported more than 1 million cases of new infection of COVID-19. And remember, these numbers are underestimates, because there are now lots of people in the United States taking home tests. And if they test positive, there's no requirement for them to report that to the authorities. But what we're seeing here is the coming together of the Omicron variant, the Delta variant, cold and flu season. You can see it's a winter wonderland out there today here in Washington and up and down the mid-Atlantic region. This is the season for respiratory diseases. And it's not just the 1 million new cases that are so worrying to public health officials here. It's also the fact that there are now more than 103,000 people in the United States currently hospitalized for COVID-19 treatment, with more than 72% of hospital beds across the country already occupied, and a growing number of intensive care units reporting that they have no spare bed capacity.
Now, Simon, what we're finding here is that the majority of those people that are in hospital, going to hospital and staying in hospital, and also maybe going through to intensive care, the majority of them are unvaccinated individuals. Is that the case as well, that side?
Yeah, that is absolutely the case here, as it has been for many months in terms of hospitalizations. One of the reasons why President Biden, who in a few hours' time will be meeting his COVID-19 response team at the White House, keeps urging Americans to get booster shots. And indeed, eligibility for booster shots has just been expanded to include the 12 to 15-year-old age group in the United States. Critically important, of course, because schools here are now back in session. In New York City, in-person school is underway. Here in Washington, D.C., there's been a delay to that. It won't be happening until Thursday of this week, because they want all the students and staff to prove that they have taken a test for COVID-19 and it has shown up negative. If you don't have a negative test, you won't be allowed to return to in-person school this week. But also alarming is the number of child age hospitalizations. More than 500 people a day last week under the age of 16 were being hospitalized for COVID-19. And while they look at the South African data and they look at the British data and they say that overwhelmingly this seems to be a milder variant, Omicron, than Delta, there is still very clearly a lot of Delta around in the United States.
So you're saying the president is meeting with his the team a little bit later on today. Are you expecting them to maybe issue out some sort of warning, some sort of measures, maybe to try and curb this lockdown of any nature?
It's very difficult to imagine any kind of meaningful restrictions being announced. This is a White House that I think, without fear of contradiction, it has been relentlessly behind the Omicron curve. It was only a couple of weeks ago that the president's own COVID-19 response team coordinator was insisting that the United States is in a different position now. It's got the tools, it's got the vaccines, it can fight Omicron. There's no need to shut businesses down or to shut schools down. President Biden himself telling the American people this isn't March of 2020. But the reality is more than 1,200 people a day are dying of COVID-19 in the United States still. More than 822,000 Americans have lost their lives since this pandemic began. And businesses, in the absence of any guidance from the government, are having to make their own decisions. And so many people are now once again working from home. Some businesses cutting back. We saw thousands of flights cancelled over the weekend because of staffing absences due to the pervasive spread of COVID-19 across the country. So whether we get a more realistic response from the White House in a few hours' time to what is being seen in hospitals, in businesses and schools across the country, I think is very unclear.
And I suppose last one, Biden's hamstrung a little bit because certain states tend to do whatever they want to do anyway.
Yeah, I mean, that's absolutely true. I mean, the powers of the presidency, for example, on the issue of schools are non-existent. It's up to each individual state and in some cases each individual city in those states to decide whether they're going to do in-person classes, whether they're going to do distance learning. Similarly, business restrictions are also implemented and policed by each individual state. But I think it has been notable, particularly over the Christmas period, that there was a real reluctance on the part of the White House to suggest to Americans that in any way they needed to change their behavior. So we're seeing now the country paying the price for another absolutely unrestricted season of travel, holiday travel, people flying all over the country, driving, taking buses and trains, no requirements to be vaccinated in order to do that. And as a result, the numbers are now ticking up in a very dramatic way.